Hello, my name is Dr. James O'Donovan. I'm an academic foundation programme doctor at Cambridge University in the UK. And in this series of videos, I'm going to be going through how to answer some common questions that come up at medical school interviews. If you've got any questions that you want me to answer or help you try formulate an answer to, then please just send me a message or write a comment in the box below. The first question that we're going to go through today, very briefly, is how to answer the question, why do you want to be a doctor and not a nurse? A question that's really common at medical school interviews and seems to come up time and time again. So how do you answer it? Well, you really need to think about the answer and think about the question and break it down into two components. The first question is, what exactly does the role of a doctor entail and why do you want to do that? The second part of the question is that you need to realise the important role nurses play, and you really need to state this to the interviewers, but also say why you don't want to do that, but recognise that they're a really important part of the multidisciplinary team. If you can touch on these two factors during your answer, then you're off to a really good start. So why is this such a difficult question to answer, and why do so many people worry about it? Well, firstly, there are often nurses on the interview panel, so just be really careful not to say anything that might potentially offend the nursing profession. But secondly, there really aren't that many differences between nurses and doctors these days. Nurses can subspecialise, they partake in research, and they host their own clinics. So really, it's a very difficult question to answer. What you really need to do is make your answer as personal as possible and try get some work experience shadowing both nurses and doctors to try and distinguish between their two roles and see which one you prefer. It's also really useful just to talk to nurses and doctors and ask them what they enjoy about their jobs and what's different between being a nurse and being a doctor. This will get you off to a really good start when trying to think about your answer. It's also really important to incorporate into your answer the important role that nurses play. As a junior doctor, I've been saved many a time by a sister or a ward sister who helps me make a decision or helps me with what dose of drug to use. And you need to remember that it's their years of experience that really help you when you're on your first week on the ward. The interview panel will know when an answer is rehearsed, so really your answer needs to come from your heart. You really need to think of your own personal way to answer this question. For example, perhaps you spent time working with both doctors and nurses, and ultimately you felt that the final decision made in the care of a patient often came down to the consultant in charge of them, and you feel a career in medicine would allow you to have this greater level of responsibility. Or perhaps you like the idea of studying a 5 to 6 year undergraduate medical degree where you go into great detail about the cellular mechanisms underlying the disease process that ultimately causes suffering to patients, and you want to find a way to alleviate this. This may not necessarily be present on a 2 or 3 year nurse's undergraduate degree. Ultimately, you need to find your own personal way of answering this question, and this can only be done through lots of work experience working with both doctors and nurses. And you always must remember that nurses play a vitally important role in the multidisciplinary team and that they care and look after the patients just as much as doctors, if not more. I'd like to hear what you think and why you want to do a career in medicine rather than nursing, or perhaps the other way around, why you're a nurse and not a doctor. If you've got any comments or questions that you'd like to ask me, just write them in the comments box below this video. And if you've enjoyed the video, please remember to give it a thumbs up and subscribe to my channel. If you want to see more videos in the series about applying to medical school or questions that might come up at interview, then just again write a comment in the box below and I'll do my best to make a video on it. Thank you very much again for watching, and I hope it's been helpful.